I'd now like to welcome the CEO of Rare Cancers Australia, Richard Vines, to launch the RCA's new report.
I'm not launching it, the Minister is. I can't help it. Every time I turn up in this place, I just think how lucky Australia is that we can have an event like this and we have access, and the Minister comes and participates in what is core democracy, so thank you. It gives me enormous pleasure to introduce the Honourable Mark Butler, Minister for Health and Aged Care. He's been a Labor MP since 2007. He held ministries of housing, homelessness, social inclusion, climate change, water and the environment. Before he was elected to Parliament, he worked as an official with the United Workers' Union for more than 15 years, including 11 years as State Secretary. In 2003, he was awarded the Centenary Medal for services to trade unionism. He holds a first-class honours degree, law degree, an arts degree and a master's degree in international relations. And we're very grateful to Minister Butler for joining us to launch our new report today, which is called Rarefication, Personalised Medicine in the Genomic Revolution. And I think we're going to grab a photo op as you come up, Minister, so thank you very much.
So Richard said he wasn't going to make a crack about Port Adelaide and then made a crack about Port Adelaide. Thanks, Richard. So kind. What a great pleasure to be here and to see all of you here today, to see real people in this building. Sometimes feel like we're scratching at the doors, just wondering what's happening out there. And then you are good enough to come and join us and talk to us about the outside world. So thank you very much for coming along here to this really significant event in the annual calendar that we're part of today. I want to thank Richard for the invitation to be here and for your extraordinary work over many years. I also want to acknowledge, of course, the Ngunnawal and Ngambri people who are the original custodians of these lands. We now call Canberra part of the oldest continuously surviving culture on the face of the planet, and want to pay my respects to their elders, past, present and emerging, and as the Health Minister of the country, recommit ourselves to the awesome but incredibly important task of closing the gap in health outcomes and life expectancy. I talked a lot over the last several weeks about the degree to which that gap is not only just not closing in critical areas, in some areas it's getting worse. And I talked about cancer. And all of the achievements we've made as a whole of population to get those cancer death rates down by about 10% over the last decade. But at the same time, we've seen them climb by 12% for Indigenous Australians. Not only is that gap not closing, it's actually getting worse. And for reasons we're very familiar with, smoking rates and a whole range of other largely social determinants that we need to work better at. So with the result on Saturday night in mind, a result that obviously we accept and respect as a government, it was proper that we put the question to the Australian people. That doesn't diminish in any way our commitment to continue working on closing the gap, including obviously in the area of cancer. Now I understand that Anne Ruston is occupied and unable to join us today, but she's represented by Gavin Pearce, the member for Braddon, who works with her in the health area. So I welcome Gavin, who's going to have the last word. So be kind, Gavin, and thank him for the work that he does in this area as a member of a rural electorate in particular. Now we come together and launch this report, which Richard has been good enough to give to us, and we're going through word by word as we speak. We've got a team going through it, Richard, combing it, analysing it, checking for typos, spelling errors. There's none. Sophie used her public broadcasting background to check it. No split infinitives, all the right punctuation. But the report's delivered at a time, as you know, and have just been hearing, I had the privilege of hearing the final part of that last presentation, this is an extraordinary period of change. I often describe as a turbocharged period of discovery that we're fortunate enough to be living through. It poses its challenges as a health sector and as a government to keep pace with that extraordinary pace of technological change, and making sure that the government systems of assessment, of approval, of reimbursement, all those sorts of things are agile enough to keep pace with a much faster speed of change than really we've ever had as a country. But we're incredibly fortunate to be living through a time where conditions that were not too long ago considered to be untreatable are becoming treatable, and people are surviving conditions that not too long ago were considered unsurvivable. At every step through this process, we are elevating the voices of patients, genuinely listening to older people about how they want to live and thrive, and highlighting the lived experience with people living with mental health right across the health system. And of course, this is also a fundamental part, and has always been a fundamental part, of Rare Cancer Australia's mission. For over a decade now, Kate and Richard have used their personal 30-year family journey with rare cancer to advocate for thousands and thousands of Australians who face the particular challenges of being diagnosed with a lesser known and often lesser understood cancer. RCA's CanForum in this building always shines a powerful light on the latest research and developments, and I'm really pleased to be with you today to discuss the opportunities and challenges in particular of embedding genomics into our healthcare system. Genomic health technologies are beginning to reshape clinical practice and change the way that we prevent, diagnose, treat and monitor a range of heritable conditions, cancer predisposition syndromes and cancer itself, including obviously rare cancers. But integrating genomics into our healthcare system cannot and should not be rushed. It requires careful consideration, planning and implementation in close partnership with the community. Genomics raises ethical, legal and social issues. At the same time, ensuring data security and patient privacy is also paramount. But I can assure you the government is acting on these complex issues, and I'd like to spend a little time that I have with you this afternoon outlining where we are on this journey. Earlier this year, all Australian governments, state, territory and the Commonwealth came together to establish the Health Technology and Genomics Collaboration. This is about developing a nationally cohesive approach to assessing, implementing, monitoring and evaluating new health technology. And it includes oversight of national activities for genomics, high cost and highly specialised therapies and services. We're working to strategically integrate genomics and other biotechnologies in the healthcare system in a way that's sensible, sustainable, affordable and fair. It's through this collaboration that I'm consulting with the states and territories on the design and remit of a new national genomics body. Consultations will be complete by the end of the year, informed by the advice of an expert advisory group. Established in July, the advisory group is there to guide us on the design, the key roles and priorities, and the critical partnerships we need to build the high-quality genomics body that Australia and Australians deserve. The group is co-chaired by the DepSec of my department, Penny Shakespeare, and Professor Catherine North, AC. Membership is broad, as is appropriate, and includes genetic researchers, clinicians, bioinformatic experts, consumers, industry and First Nations representatives. And they meet again later this month. I'm undertaking this thorough and genuine consultation process to ensure the design of a body that is fit for purpose and of value to all. And the final outcomes will be considered by our government early next year. I know also that many people here today are looking forward to the finalisation of the country's first National Cancer Plan, which I expect to launch over the coming weeks. I want to pay tribute to Dorothy Keefe and Cancer Australia for the really thorough way in which they engaged with the community in its broadest possible sense about the development of this plan. And for the first time, Australia will have an overarching national approach to cancer control and a reform agenda for the next 10 years. This includes improving equity in access to screening, diagnostic services and treatment, particularly for traditionally underserviced populations. And as everyone here knows, people with rare cancers fall firmly within this group. The Australian Cancer Plan sets out the rapid expansion of genomics in cancer screening, diagnosis and treatment, and its significant implications for cancer care, service delivery, workforce, research and data, and policy right across the cancer care continuum. In fact, as an early priority of the plan, Cancer Australia is now working on a national framework for genomics in cancer control. The framework will be for patients, health professionals, policymakers, researchers, governments, NGOs, industry, and the broader community. It will help us to determine who, how, and when people at risk of or diagnosed with cancer will have access to genomics. The focus will be on reducing any movement towards inequitable care and outcomes. Again, supported by experts, work has begun with an evidence review before broad and targeted consultations. Also underway concurrently, as you know I'm sure, is the Senate inquiry into equitable access to diagnosis and treatment for individuals with rare and less common cancers. The Department, the National Health and Medical Research Council and Cancer Australia have all provided submissions to that inquiry. I note their submission and thank RCA for also taking part, obviously, in this inquiry. And we're going to work with the committee throughout the inquiry and the delivery of its final report early next year. But in the meantime, we will also continue to explore ways to improve outcomes for all Australians with cancer. The government's investing in targeted and innovative research as a key strategy to address areas of unmet and emerging need. This includes addressing the difference in outcomes for people with rare and less common cancers. National screening programs aren't feasible for such cancers, and instead we must leverage new and emerging technologies such as genomic and precision medicine to better understand the risk without needing to understand the natural history of the disease like traditional screening tests. To support this, I'm proud to say that the government's funded two projects you've already heard about this morning, the $61 million MRFF project, the Zero Childhood Cancer National Precision Medicine Program, and also the program you just heard about from Omico. Streamlining how we govern clinical trials is another way the Australian government is laying the groundwork to harness the promise of genomics. And this, for me, is very much unfinished business. Not last decade, but the decade before last, I chaired the Clinical Trials Action Group, whose first recommendation was the streamlining of approval process for multi-jurisdiction clinical trials. And still here we are. This is a really significant opportunity. I want to thank Professor Ian Chubb particularly for the work that he's done recently on this to achieve a single national responsive platform. One that empowers us to better support strategy, research, treatments and health outcomes, particularly for those suffering with rare diseases. In addition to all this, our HTA review is progressing and considering issues raised in your report that I'm launching today, including the recommendation for a new health technology assessment pathway for companion diagnostics and therapies for rare cancers. On a final note, I just want to bring to your attention, if I need to, the Genomics Health Futures mission. It's investing more than $500 million in genomic research to improve testing and diagnosis, to help personalised treatments and to reduce unnecessary interventions and healthcare costs. And for the researchers here today, a reminder that the 2023 Genomics Health Future Missions grant opportunity is currently open, and you have just a few short weeks until applications close on the 29th of November. Nothing would give me more pleasure than to provide that research funding, the policy environment and robust frameworks that prepares Australia for what truly is a genomics revolution. One that offers a new era of equitable, safe and effective healthcare technology for all Australians. I hope you can see that hard-working government, as it is right across the health sector, is well in hand, underpinned by strong partnerships and a very clear vision. Before I hand back to Richard, and I think also to Sophie, I want to formally and really clearly acknowledge the work of Richard and acknowledge that he's stepping down, as I understand, as the inaugural RCA Chief Executive Officer after 11 extraordinary years at the helm, back since 2012 when RCA was first formed. And a welcome to Christine, who I know will continue the hard work and the commitment that Richard has demonstrated, certainly to everyone in this building I know, right across the political spectrum, but also to the broader community, lifting awareness and understanding of rare and less common cancers. It's a decade's work of which you should be extraordinarily proud, Richard. Thank you very much, everyone.